James Sangma Menteri Bidai Khmih yakatrat ka koi ka hia ka Sorkar jala ha ka nyutrik nopra arajar puai ulapli ka oxygen generator plan ha ka Nazareth Hospital. Uloang bakumba khat sau poin sau klur tengka la punlut hakini ki jaka a jing sumar private ban pen kre na ka banta ban yakun persya ya ka wat kabala jong ka klam COVID-19. Da ka bakado batang ha Nazareth Hospital ka Sorkar jala ka lathia ar klur san phui lak tengka uloang bakalong ka badun kam ki jaka a jing sumar ban pen biang ki tiar ba khat kum ka jing start ka juk menta banwan ra ya ka jingkala bat ban pen klan ya ka kum sumar. Ha ka ju por uloang bakanirap ban penduna ya ka jingta ka klam COVID-19 bat kadawru ba ka jing snokti bat jingïatreilang ka Sorkar bat ki jaka a jing sumar simet kan pen klan ya kani ka bakongsan ha ka imlang salang bat kani ka oxygen plan kan long ka jing mento ya borolang.
Private healthcare institutions like Nazareth, like Bethany Hospital, to work day and night towards providing medical care and support for all sections of society. In particular, missionary institutions like Nazareth Hospital, even before the pandemic hit us, were the backbone of medical healthcare and infrastructure in Meghalaya. When the pandemic turned our lives upside down, the frontline workers of such institutions were leading the way in providing much needed care and treatment for the public and providing support to many government initiatives. The government of Meghalaya acknowledges and recognizes the massive contribution of institutions like Nazareth Hospital. And this is why we have invested about 14.4 crore rupees in private hospitals to increase the readiness for a potential third wave. As Mr. Sampath Kumar, our Principal Secretary, had just mentioned, this is the way forward for the government. This has been laid down in our policy. And we feel that this sort of collaboration, this sort of partnership and mutual respect for each other is the way whereby we will bring transformational change in the healthcare sector. Out of the 14.4 crores that we have set aside for private hospitals, I'm very happy to inform all of you that 2 crores and 51 lakh has been invested in Nazareth Hospital. Apart from that, the Department of Health and Family Welfare has facilitated the Path Foundation, who are here, and would like to express a word of gratitude for them also, to donate this PSA plant in Nazareth by the Tata Advanced System to provide a stable flow of 800 LPM, benefiting 100 patients who will require oxygen support during critical times, possibly for a third wave, which we hope will not come, but yet we need to be prepared for. And I believe that this oxygen plant will be an asset not just for the hospital, but for the entire health system of our state. And I take this opportunity to wish Nazareth Hospital and the sisters and all the staff, the doctors, the nurses, the paramedics, and well-wishers of the hospital the very best as they add another milestone in their endeavor to serve the people of the state. As a representative of the government, I wish to assure that we will try our best to serve the people of our state to the best of our abilities, and I know that we have a dependable partner in Nazareth Hospital to try to provide access to timely and adequate healthcare to the people of our state.